Hi, I'm Keisha Reeves, a licensed professional counselor here in Atlanta, Georgia, and I'm also certified in perinatal mental health. Today, we're going to be talking about maternal mental health. In this presentation, we are going over Mental Health 101 for moms, birth givers, and families, presented by Healthy Mothers, Healthy Babies of Georgia. In today's class, we're going to be discussing perinatal mood and anxiety disorders, which you'll often hear me refer to as PMADs for short. Perinatal mood and anxiety disorders are related to mood and anxiety symptoms that occur during pregnancy or up to 2 years postpartum. Perinatal mental health is the general umbrella topic for pregnancy or postpartum related mental health, while PMADs are specific to the challenges and difficulties experienced by moms, birth givers, and their families. So PMADs begins at conception all the way up to 1 year after giving birth. So some topics we'll be going over are prenatal pregnancy period, delivery of baby, postpartum periods. We'll also talk about safety plans, support systems, preparation for emotional and mental health difficulties, and where to seek out help. So what do PMADs look like? There are clinical and non-clinical terms for PMADs. The clinical terms discussed during the presentation include prenatal, which is also referred to as antepartum, which is during pregnancy, depression or anxiety, major postpartum depression, postpartum anxiety or panic disorder, postpartum obsessive compulsive disorder. Signs and symptoms may include sadness, worry, fatigue, difficulty sleeping, restlessness, recurrent intrusive and involuntary memories, flashbacks, compulsive or repetitive behavior. And these are symptoms that happen 2 to 3 weeks after a birthing parent has given birth, not to be confused with baby blues, which we'll be going over. How do I know if I am experiencing PMADs? Anyone can develop PMADs regardless of gender, race, ethnicity, spirituality, income level, or background. PMADs does not discriminate. It is estimated that 50% to 80% of women and birth givers will experience PMADs during pregnancy or postpartum. It can last up to 2 years after birth. I often hear many people ask, is there anything that I can do to prevent it? Will I have it even before they become pregnant or become a parent? And of course, there are strategies in which one can take to reduce the risk factors, but oftentimes it's something that can just happen. But that's why presentations like this is so important, in order to know the resources in which to get support. There are many reasons why PMADs occur, and often are caused by a perfect storm of changes in biology, physiology, lack of sleep, transition in identity, and one's own experiences of parenthood versus the reality of a new baby. It's a lot going on being a new parent, hormonal shifts, changes, environmental factors, financial changes, if someone ups in moods, or even if anything occurs during labor and delivery. 50 to 80% of new mothers and birth givers experience mood swings and weepiness during the first 2 to 3 weeks after giving birth. This goes back to when I was referencing baby blues. The baby blues are not the same as perinatal or postpartum mood and anxiety disorders. Remember, be mindful if the symptoms last after the 2 to 3 weeks of postpartum. If you notice that the symptoms persist and exist, then this is time to seek out help. Let's talk about the stigma of mental health. So stigma is a major barrier to disclosure and help seeking in perinatal period. A lot of birthing parents can feel shame, they can feel as if they're not capable, or feeling as if they really want to do a good job, and if they were to ask for help, people will look down at them. And because of this, many people suffer in silence. These features of stigma can contribute to reluctance to disclose symptoms due to the fear of negative consequences. Despite this, we still believe it's important to get the attention and support you need to navigate your challenges and experiences to have a fulfilling journey that you want. I often encourage clients that I work with to look at it the perspective of, you want to be the best parent that you want to be, and in order to be able to do that is to be able to utilize all of the resources that you have possible to show up as your best self. So this is an example of a couple that is going through a difficult time and how they can be able to navigate this situation. Prenatal mental health. Mahalia and Omar are so excited that she is pregnant. Together with Mahalia's sister and friend are their support system. They've been prepping and preparing for prenatal appointments. Although Mahalia is excited, she noticed that she's been feeling anxious. a loss of appetite, and worried about how they are going to adjust to having a new baby at home. She talks with Omar on how she is feeling, and together they make a safety plan with their support system. So it's great to be able to make a list of all the people that you can identify as supports, and also define what you think supports are. Supports are not only family members, but can be friends, neighbors, church members, coworkers, just anyone in your network that you believe can be able to support you in any way possible, not only by physically showing up, but can be an emotional support, can be a physical support, or even being able to just send items if needed. So meet with providers that they trust. Trust is important, being able to have a provider that you can feel heard, that believes in anything that you are able to disclose to them, and that can be able to help you navigate any challenges that you may be facing during your pregnancy. And then to look into potential extra support systems like therapy, doulas, and or support groups. This is great because it's an example of identifying the fact that this couple is feeling anxious and what are the avenues in which they can be able to work through to help reduce those anxious symptoms. So getting ready for your prenatal clinic checks. How should you prepare? This is also something that's super important, because sometimes if you don't have an idea of what you want to say ahead of time, you may not say anything at all. So being able to bring a list of any medications that you're currently on, any questions that you may have about your mental health during pregnancy, a general summary of your mental health, contact information of your current therapist and support group, or comfortable clothes for physical checkups. And how do these conversations go? You can talk to any of your healthcare providers about mental health, nurse, OBGYN, etc. So don't feel as if because you're seeing a medical provider that these aren't topics that you can discuss with them. You can, and they can guide you towards finding the right care. They can be able to give you referral sources in which they've worked with or can identify to help you seek the help that you need. And you should not be judged. You will not be the first to ask for help. You are not alone. It doesn't mean that you're inadequate. It doesn't mean that you're coming with any shortcomings. But remember, you're trying to be the best parent that you can be, and by utilizing the support so that you can be that way. It's important to be open and honest with your provider so that they can understand the entirety of your health. So some questions to ask at your prenatal appointments. Can you explain what depression and anxiety may be like during pregnancy and postpartum? Have you cared for other people with mental health concerns during and after pregnancy? Being able to ask questions like this helps you get an understanding of the approach of your medical provider and how they've supported other clients that may be suffering from symptoms such as those. How would I be diagnosed with a PMAD? What treatment options will work best for me? If medication is recommended, what are the side effects? This is super important because there's a lot of birthing parents that have types of concerns or worries about what side effects may occur. How will it impact the baby? Will it impact breastfeeding at all? What are the risks versus benefits? Are there any risks with taking medications for my baby? How will it impact my pregnancy? And then if this course of treatment isn't working, what should I do next? It's important to know that you have a provider that you can feel safe to ask these questions to. If you feel as if you have these lists of questions, but they are dismissed, they're not heard, or it's something that makes you feel uncomfortable with asking, then that may be something for you to evaluate of, is this a provider that's a good fit for me? What will occur when I meet with my provider? So you're going to go over your mental health history, and this is for them to have an understanding of any diagnosis that you already have. If you've already been diagnosed with something like generalized anxiety disorder or major depressive disorder in the past, your provider will ask you questions about your mood history, and mental health history of you and your partner. They may refer to support services such as therapy, support groups, and potential treatments. And then laboratory tests and screenings will also be provided. Your provider might want to screen you for depression. Oftentimes during pregnancy as well in postpartum, providers may provide you with a screening. There's different types such as the Edinburgh or the PHQ-9, where they will ask you questions about what symptoms you're experiencing, if you have any anxiety that's maybe heightened or depressive symptoms that they may want to refer you for some additional support for. Medications, your provider will discuss with you any medications you are currently on or had a history with taking, as well as what pain relief medications you can and cannot take. And then if there's any medication you cannot be on during your pregnancy, your provider will discuss possible alternatives, the medication and safety precautions you may need to take. And of course, if there's medications that they haven't brought up to you or they haven't said anything, feel comfortable to be able to ask additional questions about that. What are potential treatments and therapies my provider might suggest? Untreated PMADs can be dangerous for you and your baby if you aren't well or getting appropriate prenatal care. I often talk to clients about the long-lasting impacts of untreated PMADs. It doesn't only impact the birthing parent, but it also impacts the entire family. That can include the partner as well as baby. And oftentimes, if a parent has PMADs, they may be experiencing depressive symptoms or heightened anxiety symptoms where it can impact their postnatal care or being able to get the baby to their pediatrician appointments, monitor their developmental milestones, and it can just have unwanted impacts that are lasting. So cognitive behavioral therapy is an approach that can be suitable for mild to moderate depression. CBT, which is often referred to, is a non-medical form of treatment that includes counseling and psychotherapy in a structured setting. Antidepressants are often recommended for moderate to severe forms of depression. And remember, when we were discussing medications with your provider, that can be something that you can discuss to understand whether the side effects, how it'll impact if you are breastfeeding, or if there's any long-lasting side effects. Some antidepressants aren't recommended during pregnancy because they have been associated with negative effects for the baby, though the risks are still very low. Talk to your doctor about which medication is best for you. So if you choose to avoid medications, there are other options for you and your provider to discuss, such as complementary and alternative medicine, which include massage, body movement therapies, yoga, what your nutrition is, moving your body, walking, stretching, meditation, art, dance, music, visualization, guided imagery, light box therapy, chiropractic, medication. So there's holistic approaches that can be taken if someone opts out of medication, and that can still resolve the results that they would want. Safety plan, birthing, delivery, postpartum. So open up conversation, have an honest and early conversation with your partner about what you and your baby's risk are for childbirth injuries, trauma, and coping with pain. So this is important that you and your partner are collaborative and having an understanding of what you would want this to look like, and having an open, honest conversation about what your worries are, what your concerns are, and if there's any resources to help support that. So stay informed. Take a class about childbirth to help you learn more about the process of labor and delivery so that you can ask your provider more informed questions. You can join our classes. We offer our free online perinatal education courses with a certified childbirth educator. Define next steps. Ask your partner what both of you can do to know that you'll have physical and emotional safety during labor and delivery. Is it having a doula, partner involvement, items to bring to the birthing location, exactly where do you want to have the baby, delivery positions, specific people in the room. And you can think about, what do you want this experience to look like and feel like? How do you want to be communicated to? How do you want your support person to support you? What is it that you want them to say to you to help you feel supported and heard? And making sure that your medical providers and the team that are in the room are listening to you, hearing you, and supporting this vision in which you have. Make a plan. Your birth plan and plan B should include the safety measures you are comfortable with having for both the birth and the postpartum period. I like the part that it's plan B because we like to go into this knowing that we have this ideal plan, but we know that it may not always go the way that we want it to go. There can be pivots and turns that come around, but it's so important to have like the ideal in which you would want it to work out. So share this with your support partners, your provider, and those that will be prepared to advocate for you and your baby's safety. And again, when choosing a provider, making sure that they hear you and they understand that you have a birth plan versus dismissing your idea of having a birth plan. So sometimes having a doula can help you communicate with your partner and help you to have a safer birthing process. Take notes. After the birth of your baby, have a loved one take notes when you have conversations with your pediatrician and provider. So be mindful of what you are feeling, what symptoms you have after you've given birth, if there's any questions or doubts or worries that may be coming up for you, even while you're in the hospital or immediately once you get home. Things they can say easily be forgotten once you are caring for your new baby. Make sure you know what warning signs to look for and who to contact if concerns come up. Please be aware of the post-birth warning signs, also detailed in our blog. So for partners in support systems, if you recognize signs of depression or anxiety in a friend or family member who's pregnant, postpartum, or support partner, you can reach out and have a helping hand. So also be mindful, because this is a lot of information just for the birthing parent to take on. So if you are a support person, know what the signs and symptoms are, know what the plan is for your birthing parent, know what they would like their labor and delivery to look like, and know if they're voicing to you any concerns or worries that they have. Take note of this, write it down. Just have a mental note of all of this. So in the event that your birthing partner is in a place where they may not be able to adequately communicate what it is they're experiencing, you're there and you have given witness. So first, tell them that you're there to listen. Don't dismiss your loved one's feelings, but do encourage them by pointing out the positive things in their life. Be prepared to take action. You might need to drive them to a doctor's appointment, shop for groceries, or cook dinner. If you suspect self-harm, get immediate help. You and your partner. If you're in a relationship, pregnancy can be an opportunity to grow closer to your partner. Make time to talk and to listen to each other. You're the one with the baby bump, but you are the person that is on the journey with them. Talk about fears, excitements, and anxiety. Encourage your partner to be actively involved. Remember, you two are a team. And then it's also often important to remember your communication styles, like how you want to support one another. What are the verbs or the adjectives or the things that you want to be able to hear, that you feel supported, and being able to use them. Notice that these can be stressful moments, these can be worrisome moments, but being able to verbally and physically support one another as you get through this journey together. You and your family and your chosen family, if you're close with your family, get them on board from the beginning and let them know you're open to hearing their words of wisdom. Many birth givers and support partners look to their moms, sisters, uncles, and other close relatives for the main source of support during pregnancy. If your friends are more like family, reach out to the ones that you want to add to your team and let them know. This goes back to when we were talking about making that list of supports. Being able to identify who can support and how they can support. Not everybody can support you in the same manner, but being able to identify who has different strengths and how they can show up for you, and in what ways do you need them to show up for you. You and your community, surround yourself with people who have been through the process, or who you see as people that are a positive influence and encouragement during your journey. Similar experiences help you feel connected and supported and will provide some relief. And I know that not everyone has family or friends that can be aligned to the birth journey in which you would want. So being able to identify those that do, and that may be participating in support groups during pregnancy and finding like-minded people who are similar to your journey in which you would like, and those can be supports for you as well. So what if my partner or I is experiencing mental health difficulties? What do you do with that? Accept help from family and friends. You can also let people know that your family needs extra support right now and suggest what they can do to help. If your partner is experiencing mental health difficulties, you could take more responsibility of household chores. Or if your partner is physically exhausted, you can be able to help with cooking meals and laundry. It's important that you are able to identify what needs to be done and being able to support them in taking care of those additional tasks. If your partner is feeling overwhelmed, take the baby out for walks so that they can have some alone time. Encourage mom or the birthing parent to rest and that you have the baby covered and safe with you. Don't offer unwanted advice. Listen and let the partner open up when they are feeling like they're able to, and try to be gentle and encouraging. I also like to include, when we're talking about that list or ways to communicate with our partners, being able to hear from them and what are the things that you would like to hear to feel encouraged. What is it that I can say or do? Those are things that you can discuss during pregnancy before postpartum, so that those things can go into action once those overwhelming or anxious moments show up. Help to maintain connection with family and friends, even if it's limited phone calls and video calls. And look after your own physical and mental health. This will help you to be the best support for your partner. So although you are taking care of this birthing parent and being able to be a huge support to them, don't forget about yourself so that you don't have any type of burnout as well. So, interested in support groups? I love support groups. I think that they are phenomenal because it's an opportunity for parents, birthing parents, to be able to meet others that are similar to them, that are going through the same journey, and to also learn about resources in which another family is being able to utilize to help them exchange ideas, feel supported, feel heard. There's so many statistical benefits of support groups. So social support is a critical component to mental health and management of PMADs. Internet communities provide important meeting places for postpartum birth givers and mothers to network and augment their care through emotional, information, and instrumental support. There's various types. There's ones that can be virtual as well as in-person support groups. So social support can be preventative against postpartum depression and other PMADs. And it's also good to keep in mind that when we're talking about virtual support groups or online support groups, that it's specific to support groups. Sometimes we can look to social media as being a form of social support groups, but those aren't moderated or being able to be vetted by an actual professional. So being mindful of that. So P&I mom-led support groups, which is Pickles and Ice Cream, is one that is supported by us. Postpartum Support International also offers support groups. There's Facebook groups, apps available like the Peanut app, and there's in-person groups such as listentomoms.org. So in preparation for delivery, here's another example of someone else. Chidima and Luna are really excited for their new bundle of joy. But the last few weeks of the pregnancy have been hard for Chidima, and she's been struggling with difficult thoughts of how the delivery will go. Her mother had a difficult time when she delivered, and Chidima is worried that she'll go through the same thing. Totally normal. Anxiety or worrying about labor and delivery is something that's super common, especially for first-time parents. So before Chidima's delivery, she talks to Luna about how she is feeling scared and anxious, which is good. She's communicating this with her partner. Together, they go over coping skills during delivery. So these are things that they can be able to do together, or this is how her support person can be able to show up for her. So what to expect as they get closer to delivery in the delivery room and afterwards, being able to write those things out are great reference points to be able to look to before the big day. And then how their doula can best support them during labor. So being able to identify ways the doula can be able to show up for the both of them, show up for the birthing parent as well as show up for the support person to help being that mediator and that go-between person. 32 weeks and getting closer to your due date. So even if a mom or birth giver had a smooth pregnancy, severe anxiety or fear may develop during labor or childbirth. Although normal levels of anxiety regarding birth and labor are reported by 6 to 10% of pregnant people, many women develop fear or anxiety towards childbirth. It's an experience that unlike anything else, so it's understandable, again, that anyone would be anxious or worried about giving birth. So labor is unpredictable and occur at any time and any point, leading to worry about going into labor at an undesirable time, which may negatively affect access to a desired physician or method of delivery. Some other factors that can increase anxiety associated with labor can include low self-esteem, pre-existing medical conditions that can already cause anxiety during pregnancy, lack of social support, fear of loneliness, fear of pain, and or prior negative birth experiences, racism, toxic stress, discrimination, and being able to look at the statistics of maternal mortality, hearing various stories about other Black or BIPOC families giving birth and the difficulties in which they may face can cause anyone to have high anxiety. And if you've never experienced labor and delivery before, just being worried about your own life, your child's life, and what the experience may look like can cause a lot of worry. So, what are some coping skills to help get through this? Music to soothe the labor. I always encourage anyone that I work with to come up with a playlist. Music that they can find to be soothing, calming, help them stay present, and push away some of those worrisome thoughts. So while using headphones to listen to music like classical music or sounds of the ocean, the rhythmic body motions can help with your attention, focus, and provide pain relief. Comfortable birthing positions is also a good one. So positions like sitting on a chair with your feet up or utilizing a birthing ball, which can increase comfort to aid in your baby's descent. So remember to change positions every half hour. This can help shorten labor and make it more manageable. Massages is also a huge one. So being able to find locations or places where you can get a prenatal massage, or if it's during pregnancy, having your partner practice on giving you massages and how that can be supportive and helpful and also relieving for you. So constant light, firm stroking that can be done on your abdomen, arms, legs, or back. And oftentimes a doula can help partners learn ways in which they can massage. So support partners, try pressing with your fist or palm on their lower back. So some other coping skills to consider: visualization and relaxation, creating soothing images in your head. This is that imagery exercise that we talked about a little bit earlier. Visualizing what you think this experience will look like, feel like, sound like for you, so that you aren't competing with the worries or the anxious thoughts that you're having. This is something that you can be able to think about in your mind. So imagine yourself on a beautiful island, try neuromuscular control exercises. And the ways to implement boundaries. This may not be as feasible during labor, where there will be nurses and providers coming in and out of the room or in your space. But find other ways in your pregnancy you can respectfully practice your boundaries with others. This helps feel more connected and in control of your body. Breathing techniques. So be open to the unexpected. Breathing techniques is often helpful because when we're anxious and when we're worried, we can sometimes forget to take deep breaths or just breathe at all. So relaxation and proper breathing during labor will help you a lot in the birthing process. Breathing steadily during labor increases the mother's focus and brings much needed oxygen to her and the baby. Some breathing techniques can include organized breathing, slow breathing, light accelerated breathing, variable breathing, and explosive breathing. There's different apps for birthing parents that are expecting in which they can practice different breathing techniques. So those can be useful to be able to look into. So what is a doula and how can they help? Doulas are amazing, and it is someone who provides physical and emotional support during and after pregnancy. Important information to know about doulas. Doulas' fees can range. So currently most insurance plans and Medicaid do not cover the cost of doula services. Provide information and support on infant feeding and infant soothing. So they're very educated on the childbirthing experience and babies and how to help you or equip you with preparing for new baby and labor and delivery. So they also provide emotional and physical recovery from delivery. So several doulas offer postpartum doula services. And then they can also help with light housework and basic meals. So relieving you of any type of chores or responsibilities that you can feel obliged to have to take on after you've gone home. They can help you with those needs. And then statistics show that doulas decrease unplanned C-sections. So it's helpful to be able to have that additional support. I work with clients, sometimes they may feel as if they have a support person, so they may not need a doula, but sometimes it's helpful just to have a doula be a support to your partner as well as to yourself and just help you really visualize the labor and delivery experience that you want and then be another support during your postpartum experience. Action. Where can I find a doula? An important question to ask. Healthy Mothers, Healthy Babies Coalition of Georgia can help you be matched with a certified doula for free or low cost. Just follow the steps below or call the phone number to be connected or email the Pickles and Ice Cream team and they will help you get matched. So another scenario for recovery and postpartum mental health wise. Jennifer, a single mother, recently delivered a healthy 7.3-pound baby boy, and labor went extremely well. After delivery and returning home with the baby, she started to feel sad, irritable, and began to cry very often. These feelings lasted for 8 weeks. After the baby was born, Jennifer finally reached out to a friend to talk about her recent feelings and emotions with the help of her friend. So, things to point out. So these symptoms in which Jennifer was experiencing lasted past the 2 to 3 weeks postpartum, and she identified the symptoms in which she was experiencing, and then she reached out to her support system. This is important because remember, we talked about you want to show up to be the best version of yourself. So Jennifer scheduled an appointment with her OBGYN, who referred her to a psychiatrist. So she talked to her medical provider about it. She was open, she was honest, and her medical provider was able to get her connected with someone that can support her. Found an online support group specifically designed for moms like her. So being able to find other moms that are single mothers, that are raising a baby on their own and experiencing symptoms can help you not feel alone. And then she agreed to allow her friend to come over a few times a week to watch the baby and allow her to get rest and to do some self-care activities such as working out. So this is important because sometimes some moms can feel as if they should be able to do it all alone, or they shouldn't ask for help, or they look as if they're inadequate, if they need some additional support. But it's reframing that, and it's thinking about, I want to be a phenomenal parent, and how I can be able to do that is by getting adequate sleep, is by resting, is by doing some things that help me feel good, is by being able to see a medical provider that can additional support me, as well as being able to connect with other mothers that are like me and are on the same journey. That's how I can be the parent that I want to be. So perinatal mood and anxiety disorders, to talk a little bit more about postpartum depression. So it lasts longer than the first 2 weeks. So remember, first 2 to 3 weeks is baby blues. If the symptoms last past that, then we go into PMADs. So it can begin immediately after birth or anytime within the first 2 years. Postpartum anxiety affects at least 10% of mothers, and it can be characterized as constant worry, racing thoughts, the feeling that something is going to happen, disturbance in sleep and appetite, inability to sit still, hot flashes, and dizziness. Postpartum anxiety is very common. So if you often hear of it as, I'm worried that something will happen to my baby, will my baby get sick? I shouldn't sleep because I should watch them as they sleep. I should make sure that they're still breathing. Just constantly feeling as if you're worried that something is going to happen to you or them or people that you worry about, and feeling as if you cannot calm yourself or stop your thoughts. So during your recovery period, in referencing postpartum depression, you may feel tired, overwhelmed, stressed, having feelings of loss of your identity, and have less control over your time. So with postpartum depression symptoms, there's a lot of nervousness, anxiety, panic, restlessness, lack of interest in the baby, feelings of guilt, irritability, and rage that can just look like anger. So a new mother or parent may not recognize depression or anxiety because they are tired and overwhelmed or simply adjusting to life with the baby. And we tend to blame ourselves for not being able to handle things instead of realizing that is a medical condition and not a sign of failure. So this is when it's super important that if you have a support person or a partner, that they're able to recognize these symptoms and pay attention to what it is that you're exhibiting so that they can be able to talk to you about it if you're not able to recognize it for yourself. And both of you or just you are able to talk to your medical provider and get some additional support. With postpartum anxiety, keep in mind that most, if not all, new parents experience some worry. It's okay to be worried, and it's completely normal. But the symptoms of postpartum anxiety disorder include constant or near constant worry that can't be eased, feelings of dread about things you fear will happen, sleep disruption, racing thoughts, fatigue, Remember when I was talking about, sometimes I've talked to parents where they can't even sleep because they're worried that they prefer to look at their baby while they're sleeping versus taking sleep for themselves. This can also be postpartum panic disorder, postpartum obsessive compulsive disorder. So with postpartum OCD, you may feel obsessive, reoccurring thoughts about harm or even death befalling to your baby. That it's often being worried that something detrimental is going to happen to your baby and doing whatever you can do to prevent something from happening. And that can be not wanting to drive anymore, not wanting to walk down the stairs, not feeling safe about having them sleep in their crib, not being able to feel comfortable about them being safe in the car seat, in the back seat of the car, just anything that is disrupting your normal functioning of life. So with postpartum psychosis, it is very different than postpartum depression or postpartum OCD. So with postpartum psychosis, it's very serious, but it's also rare. Only 1 to 2% per 1,000 births experience this. But just because it's rare doesn't mean it's not something to be aware of and to be conscious of. So this is when mothers experience bizarre delusions and hallucinations. So the difference between postpartum psychosis versus postpartum OCD, well, postpartum OCD, a parent is aware that they are overly anxious and they're overly worried of something happening, and they're aware that this is irrational, or they feel uncomfortable with the thoughts that they're having, versus someone who's experiencing postpartum psychosis are oblivious to the thoughts that they're having being irrational at all. They feel as if their thoughts are perfectly fine and may not voice them at all because they don't think that there's anything wrong with them. So if you feel like you may be experiencing symptoms related to postpartum anxiety, depression, OCD, or postpartum PTSD, stress, reach out as soon as you can and talk to supportive or informed people. If you notice your partner is struggling, offer support in any way that you can, being able to listen to them and help them get the help that they need. Maternal suicide. In recent years, suicide has become an increasing cause of death in perinatal women. It is difficult, however, to conclude just how common suicide occurs during pregnancy or the postpartum period because it is so underreported and under-researched. Suicide attempts amongst pregnant or postpartum mothers have nearly tripled in the past decade. Maternal suicidality overall increased from 0.2% to 0.6%, with the greatest increases seen among Black, low-income, younger individuals, and people with comorbid anxiety, depression, or serious mental illness. Suicide accounts for 20% of postpartum deaths. Maternal suicide risk is not limited to the immediate postpartum period. It is important to continue providing women with medical, mental health resources and support throughout the latter postpartum period. Below are different hotlines and resources in order to contact if you or the birthing parent in which you are supporting are experiencing any types of suicidal thoughts of harming themselves or the baby, in order to get the support or help that they need. So communicating responsibilities and tasks with partner. This is super important. We talked a little bit about this, about what it is that you would want to be supported in, how do you want to communicate, what are your communication styles. So for your partner may have to take responsibility of things around the home that they might not have had to worry about in the past. So communicating your needs with your partner and your partner communicating their needs before the baby is born, and create a postpartum plan. So being able to sit down with each other, write out, how can I show up? In what ways would you like for me to show up? What can I do to help you? What would you like to hear? How would you like for me to take initiative? Are things that can be super useful. So even if you're planning on breastfeeding can feel like a full-time job. What are the other tasks that your partner can do while you're breastfeeding so that you can feel as if it is more support, it's a more even playing field, and both of you are able to get things done while you have this huge support or thing that you're working on your own. So if completing tasks during this transition seem like it might be too difficult, then you or your partner may want to consider hiring a postpartum doula. And we talked about how you can hire a doula in our previous slides. What's a postpartum plan? Well, it is a way to ensure that you will be surrounded by an environment that will support your health, baby's health, and boost your confidence as you navigate through the transition. So having a postpartum support network, We talked about being able to identify who can show up for you, who can support you in the ways that you would like. Being able to boost physical recovery and confidence that will grow over time can be able to be established if you have that network established. A postpartum support network can include your partner, family, friends, trusted community members, and healthcare professionals that you can identify and depend on. Support can include physical support. It can be emotional support from loved ones or a healthcare professional, and spiritual support. When preparing a support team, speak to your partner, family, and friends about how they can be there for you. So coming up with this postpartum plan is ideally something to be done during pregnancy, being able to communicate your supports about how you would like for them to show up to you prior to postpartum. And then once you have the baby, all people are already put into place and know what responsibilities that they have. So what's in the postpartum plan? Contact information for your healthcare provider, reproductive life plan. So what does the timeline look like for having more children? You can also talk to your provider about birth control to reduce the chance of getting pregnant again too soon. Too little time between pregnancies can increase your risk of premature births. Feeding your baby. If you are planning to breastfeed your baby, if you are going back to work or school after delivery, what is your plan for feeding? You may want to consider a lactation consultant, support groups, or breastfeeding peer counselor. And then discuss common physical and emotional changes after pregnancy with your provider. What are some symptoms and signs of serious health conditions to look for after giving birth? And then pediatric health care. Your baby may have appointments with your pediatrician as early as the first week of being a newborn. So speak to your baby's pediatrician about the type of schedule and duration of appointments that will be necessary in the first weeks and months after birth. So to get your own free postpartum care plan template, please visit our website and download your very own postpartum plan. Body changes and dysmorphia during pregnancy is something that is hugely common and not often talked about. So body dysmorphia is a mental health problem about the appearance of your body. You may become so concerned about the appearance of your body that negative thoughts impact your daily life. Constantly checking yourself in the mirror, trying to hide your body or body part, constantly comparing yourself with others, avoiding social activities, feeling anxious, depressed, or ashamed. Often work with birthing parents who feel as if their bodies don't look like how it looked before they got pregnant, feeling shameful, or even feeling the need to hurry up and lose the weight or getting back in the gym in order to have their pre-baby body. It's normal that your body is going through these changes. You may see stretch marks, weak pelvic floor muscles, and or a new body shape. Give yourself credit for an awesome ability that your body was able to bring this new life into this world. Be kind and respectful to your body and to yourself. And it's often important that you understand that giving grace to yourself is something that is essential. It took nearly a year to create your baby, and so not to expect that your body would go back to the way that it was, and being able to give grace in the event that it doesn't. So take your time and really try to speak positivity to yourself about your body. Where do I go when I have questions? We talked about before about being able to talk to medical professionals like your OBGYN, pediatrician, nurses. Healthy Mothers, Healthy Babies of Georgia also has a phone number in which you can contact. And then be aware of the internet. We talked about how social media can often have false information and not to consume certain types of content. So just because information is on the internet does not mean that it's true. Look for websites from reputable sources. Frequently asked questions. So how is postpartum depression different from baby blues? We talked about the time limit. It is not about the severity of the symptoms, but it's where you are in your postpartum. So if it's within the first week of postpartum or the second week of postpartum and you're experiencing symptoms, then it's likely to be baby blues. But if it lasts past 2 to 3 weeks, then you are in the PMADs territory and you need to seek out help. Speaking to your medical provider about the symptoms in which you're experiencing. What and when should I find mental health resources or a therapist? You can find a mental health therapist as soon as you become pregnant. I like to encourage those that are pregnant to go ahead and find a therapist even before postpartum, so you can already have found someone that you feel as if you have a great rapport with, you have sought out someone that you feel as if you are feeling heard and can be able to support you during that postpartum period. What should I do if I think I have perinatal depression or anxiety? talk to your medical provider. Reach out as soon as you can and talk to supportive and informed people. You don't need a diagnosis to reach out for support. You can call Postpartum Support International or start by talking to your care provider. How much should I exercise after having a baby? So being mindful that you have this conversation with your medical provider, find out how many weeks postpartum you are and if you have been cleared. And then you should start at least 150 minutes of moderate intensity aerobic activity each week. When can I resume having sex after having a baby? It is advised that you wait 4 to 6 weeks before resuming sexual intercourse. At your postpartum appointment, you can discuss options for contraception with your healthcare provider. If I am breastfeeding, does this mean I can't get pregnant? Breastfeeding only works as birth control if you're exclusively breastfeeding and only for the first 6 months or until your period returns. We don't recommend relying on breastfeeding as a method of birth control. Maternal mental health online support. So please join our online mom-led peer support groups. You can go onto our website and find several different peer support groups for moms by moms. Support groups are essential, and I've talked about how it's so important because you're able to hear from others that are going through the same experiences in which you are, and you cannot feel alone, be able to get several resources and learn from others in which ways in which they're coping. So below are a list of current resources that you can take advantage of. So please, if you have any additional questions, call or email in order to have any referrals or additional information provided to you. Thank you again for joining me as we learned about maternal mental health. I hope all of these resources and strategies will help you on your parenthood journey.